Well, preparations are underway to brace for what is anticipated to be a peak in the number of COVID-19 cases in many provinces. This includes, of course, Gauteng, which is seeing about 28,000 cases at the moment of COVID-19. But we are here at the Soshanguve clinic, where the MEC of Health in the province, Dr. Bandile Masuku, is in fact visiting to volunteer. He does this on a monthly basis, where he comes to a health facility in Gauteng and actually comes to support some of the staff and some of the patients here. But MEC, thank you so much for giving us this time to actually catch up with you. And one of the things we did say was that the preparations are underway, but just take us through what the picture looks like for Gauteng, and if we will be able, in fact, to be ready once that peak starts.
Yeah, I think we are here in the CHC to lend support and also to lend a hand to our staff members. It is one of our endeavor that we have agreed to do every month, that we will come and volunteer one day where I will come and do some actual clinical work. And I think we are bracing ourselves for the peak. We are not yet there. The numbers are just showing us that this is an expected peak, the expected increase that we were actually planning in terms of modeling, and a lot of work has been put into place, and we are clearly that towards the end of July we would be able to deal with all the pressure that we are seeing.
As far as capacity is concerned, where are we as a province at this stage, and what is the target then?
The issue is that the beds are enough between us and the private sector. The whole thing that we are trying to do is now to make sure that we are able to have enough when we will actually be able to require. We have started a process of putting up field hospitals, which will help us in a great deal to reduce the pressure in our facilities. And at the moment, we are just continuing to do more work in that regard. And construction has actually earnestly begun in many of the facilities where we are putting up permanent ward beds and facilities in those areas.
And are you able to perhaps give us those numbers in terms of what you're anticipating would be enough, even though, of course, that would be just a prediction, but your projections of what would be enough in terms of the Gauteng province being ready for that peak, or to tackle that peak time?
We are looking at having 15,000 beds that will be available between us and the private actual hospitals. But I think if we can be able to develop more, we can be able to. We are even under discussions with the private sector to even acquire some of the hospitals that we can be able to utilize in case we are going to require them.
And from that 15,000 you're looking to have, how many do we have at this stage?
At this stage we are almost at 9,000, and we are putting up 1,400 beds, which are distributed across the province. 300 in Kopanong, in Sidibeng, another 500 at Barak Krisadi Panagwanath, another 300 at George Mokari, and another 300 at Jubilee Hospital.
And how is the province dealing with the issue of PPEs? Because we did speak to one of the frontline workers here who just take us into their confidence to say that there's not enough in that regard, and they sometimes have to salvage whatever they can to ensure that they continue. But in terms of the issue of PPEs, how is that being addressed? Is there an issue around that? And also, if you can just tell us that the procurement of those PPEs moving forward to the peak time, will it be enough, and what are the preparations around that?
We will never have enough. We will continue to be procuring PPE, and I think it's important that we continue to support our staff in the provision of PPE and making sure that there's always adequate. We have always actually established a hotline where our staff members can be able to call and WhatsApp to make sure that they can be able to get immediate assistance when we are running short of it. But it's something that we are procuring continuously to make sure that we never run out of it.
And just as a final question, the issue of the frontline workers who are also affected by COVID-19, particularly the infections that you have? What are the numbers looking like there, and perhaps what are the lessons you have been able to learn to improve upon the protection of those that are at the receiving end of those of the patients?
I think what we have learned, particularly from Helen Joseph and Kopanong, is that we totally forget when healthcare workers do leisure things, when they interact, particularly having tea or having lunch, because most of the work that we have seen or the infections that we have seen, they are not directly from actually patients, but it's still a lot of work that needs to be done just to understand how the infection actually is happening. But the preliminary that we have done just shows us that at the moment it's between staff members themselves.
And final one. For Gauteng residents, just in terms of your predictions of when you guys will then be, because I know you're putting more beds out soon, but in terms of having that number you're desiring, is there a timeline you can give us?
Yeah, mid-August towards the early actually September. We're hoping that we'll be having enough, and that's when the prediction is in terms of the modeling that we will be having the peak.
All right, I won't keep you any longer. Thank you so much, MEC. Just giving us a sense of the preparations that are underway in Gauteng to ensure that they brace for that anticipated peak of COVID-19 cases in the province and in many other provinces. But what the MEC is saying is that this is an ongoing process at this stage, and they're projecting that by August, that is when they will be able to say that they have been fully prepared. That's the anticipated date of being ready for this particular peak of COVID-19 cases, but it does seem that those processes and those the preparations are underway, and that's exactly what the MEC is telling us.